my friend has a normal stress test with an abnormal EKG. Is that okay? And Rahul, you might want to just give it a quick shot at it. And there was another question follow up for you, Rahul. So it's normal, abnormal EKG, normal stress test. And then the next question follow up is, I'm an engineer. I marvel the engineering behind deploying devices, but is there any way to minimize intervention?
Okay, so first question, abnormal EKG, normal stress test. Without looking at the EKG, an abnormal EKG can range from the benign abnormal, which is the variation in human health and anatomy, all the way to the abnormal that requires further investigation. A stress test, like any test, is not 100% perfect. And depending on the conditions, we talk about the sensitivity of a test, which is the ability to detect disease. And depending on the nature of the stress test, it can be anywhere from 60 to 85% sensitive, which means it could miss 15 to 40% of disease. That's the short answer. So really, we need a bit more information. But again, have a good cardiologist that goes through your test results with you.
Right.
The second question about minimally invasive, we are in an exciting era of interventional cardiology where, as you can see, we're now able to replace valves through an incision this big, through an artery or a vein. We are still trying to get smaller and smaller. Of course, modifying lifestyle factors and preventative aspects will help you get into these states. But unfortunately, sometimes, regardless of your best efforts at diet, lifestyle, some of these are not preventable at all. And so you may still end up requiring a procedure. And so I think in the appropriate setting, you shouldn't delay the need for a procedure if indeed it's warranted.
Thank you.